We don't always know what causes diabetes. It can be lifestyle, it can be genetics, it could be a big traumatic illness in your body. It's smart to be mindful of your family history and your chances or risks of developing diabetes, but don't be afraid, but instead get educated. You can't necessarily make your diabetes go away, but you can make your diabetes more manageable, which means you'll have a normal, healthy life. No, it actually has a negative effect on your pancreas, and it's best to eat often throughout the day from a variety of foods. Of course, all foods are good foods. The poison may be in the portion, so be mindful of how much or how often you're eating a food. You are never a failure for a diagnosis of diabetes or a change in medications. What you can do to take care of yourselves is get educated and be prepared for changes that'll happen at times. It's important that you take your medications every day, even if you feel like your blood sugar is okay or looking good. Check with your doctor before you discontinue any medications. All foods are good foods. There's a place for everybody on the plate. There are no good fruits or good vegetables or bad fruits or bad vegetables. Again, think about the portion, how often, and if you're getting a variety. Both white and wheat bread or grain, cereals, pastas are all the same carbohydrate. They might take a little bit longer to digest when they're wheat, but ultimately they're all going to need insulin to be turned into energy. It's important that you don't save up your carbs. It's important that you give your pancreas a break throughout the day. That you give it work, give it break, give it work, give it break. It's best that you don't skip meals. You want to eat often. They have a place for your plate sometimes. Meal replacement shakes can work to help replace a meal if you don't have time to eat a meal or a snack. Just make sure you're getting a variety of foods on your plate. Keto will not cure your diabetes. It's best that you get a variety of all foods and you have adequate carbs throughout the day at every meal. All carbs are carbs. A carb is a carb is a carb. Every type of carbohydrate will be turned into glucose, which requires insulin to be turned into energy.